Hi, welcome to Larkin Health System. I am Ravi Gupta, a proud internal medicine resident here at Larkin. I am extremely elated to introduce to you an extraordinary health system here operating in the state of Florida. As a city, Miami is a wonderful place to live.
Our mission is to, provide compassionate, care in a teaching environment to serve the needs of the community that we serve in a culturally appropriate manner. And by that I mean that the healthcare providers that are delivering services reflect the population that we serve.
We have a lot of partnerships. And that is the key word, partnerships. The other key word is integration of care.
We have basically an internal medicine program that's very cohesive with different fellowships. We have gastroenterology, we have pulmonary, we have critical care, we have rheumatology, and basically it allows, I think, the residents to have a day-to-day interactions with fellows, with board-certified physicians in different fields. They can actually participate in daily and weekly didactics in those fields, and they get to actually meet the program director on a one-to-one. So I think that cohesiveness, brings the resident like a holistic approach to the care of the patient.
In our program, you're going to see the same small cadre of people over and over, and they're going to get to know your strengths and they're going to get to know your weaknesses. Okay, and it's kind of like living with your parents. They know what you're bad at, right? They know if you're not taking out the trash on time every day. They know you're lazy. Okay, so we get to know you very well, and then we really focus in on what needs to be improved.
We have residency programs for all different types. Everyone is always willing to teach, and everyone should be willing to learn, because at the end of the day, we're all in the residency program trying to learn, trying to be better doctors.
As far as education, we have tumor board, we have morbidity and mortality, but even more so, I think it definitely depends on the resident, what kind of person you are. You have to be able to, if you want a fellowship, find cases to write up, be involved in research, just be very proactive in finding what's available. If there's a fellow who has a project, something going on, write up interesting cases you've seen. We do have plenty to choose from, and submit them to the different societies that are out there.
I feel the best way of learning in medicine is talking to patients. So whenever I have students with me, I push them to go see the patient. And I'm like, go talk to them. Let's see what you get.
For me, it was really, really therapeutic to come here. I didn't realize how much I needed to be in Florida until I got here. And just being in the sun. My wife, she says we have a family rule. At least once a month we have to go to the beach, and it's been so nice.
Who is the most important person in the hospital? And you'll be surprised. More than 50% say the owner of the hospital, or the director of the hospital, or the doctor who takes care of the patient, or the medical team, whatever. So more than 50% don't think that actually the most important person is the patient.
If you very nonchalantly approach the obtaining of history and physical, it's difficult to think that you're going to establish a worthwhile relationship with the patient. If you act in a rushed fashion, the same is true. The more contact and trust that you have with the patient, the easier it is to obtain the information that you require to make a correct diagnosis or to convince him to go into a given treatment.
A good coach, a good mentor, doesn't let you rest on what you've accomplished. They push you to become even better.
Opportunities are there. I think it's, we have to search for it and work hard. Obviously integrating research with the clinical responsibilities can be difficult sometimes, but I think we have good guidance and mentorship.
We have gems here of attendings that have great experience. Majority of our attendings in the internal medicine program actually came from the University of Miami program, and you get great academic experience, knowledge from them, as well as great community experience with the underserved population in South Miami and Hialeah. We have 2 campuses in Palm Springs and in South Miami.
Larkin is a combination of old school of thought like mentorship plus the new school of thought like knowledge and books. So it's a very composite program, and a lot of mentorship is available.
Be ready to act at any time, not be checking the watch and see what time you have to leave. That's Walmart or any other job. We are doctors and we have to be ready and well predisposed to work. Those are the paramount things that the resident has to bring, not to this program, to every program.
The residents are in front of the patients all the time. They need to look good, appear good, because the patients want to have that happy feeling that they are going to be treated and look better and feel better about themselves.
When it comes to medical knowledge, you will get that over time. I don't necessarily look for somebody who can regurgitate Harrison's internal medicine book back to me. I don't look for somebody who can sit there and answer every single question on MixApp or UWorld back to me. Instead, I look for somebody who has the ability to formulate a plan, formulate a thought process, and little by little build on that until they get to a level where they feel comfortable enough to be on their own.
What I would say I'd really look for in an applicant, number one, is a willingness to work as hard as you need to get the job done.
The importance of discipline, the importance of timing, how you show up to your appointments.
I think the worst mistakes are made when we are a little bit overconfident of our ability and we kind of diminish other people's abilities.
In the medical field, being compassionate with your patients, treating your patients as if they were your family. If you're treating a patient, think of the patient as your mom, your sister.
The 3 A's to success are number 1, availability, number 2, affability, and number 3, ability. So you might be the smartest guy in the world. If you're not available, if you're not affable, success might just not be there for you. So I think it's imperative for all.
It's just instilled in you. You work hard, you don't expect anything from anyone, and you basically earn everything that you want out of life.
Larkin has a state-of-the-art 23-bed ER. We have access to CT, X-ray, nuclear scan, and multiple technologies. Our infrastructure is comprised of Larkin Community Hospital, with campuses in South Miami and Palm Springs. Come to Larkin. Where caring is second nature.